I hurt myself in PE. I did a push-up and I felt my shoulder pop and I immediately could feel the pain and I just couldn't lift my shoulder.
So Caleb first came to me with kind of a vague collection of complaints. So when he came and saw me, one of the first things I did was I examined him, but I examined him with his shirt off. And I looked at him from the back as he tried to move his arms. Your scapula, the shoulder blade, moves in a very predictable pattern in normal anatomy. But in patients that have this condition, it's very asymmetric compared to the healthy side. And then classic signs of tenderness right here on the upper chest, pain up here in the trapezius, and then radiating down the side of the scapula, and then pain going down the arm, pain when he tried to turn his neck one way, stretch his arm. That's a very consistent and classic set of symptoms for neurogenic thoracic outlet syndrome. If you're not accustomed and trained to seeing the scapula and knowing how it moves normally, you're not really going to be able to understand the exact reason why this patient has thoracic outlet syndrome, because even within this umbrella term of thoracic outlet syndrome, there's a lot of different subcategories. In terms of treatment for thoracic outlet syndrome, like so many things in orthopedics, we try to start non-surgically. If they respond to therapy, then that's wonderful. And if not, then we talk about surgery.
After the original orthopedic said that it was possibly thoracic outlet syndrome, he explained to us that there was a possibility that the surgery, they would actually have to remove a rib, and that would open up the space. So when we got down to Baylor and we met with Dr. Ahmed, he actually said that that surgery is not as successful.
We found that surgery does not work as well and is not as reliable with pretty high risk. And so now we have a newer option, an endoscopic approach. So endoscopic management for thoracic outlet syndrome basically involves a couple little portals, like tiny little keyholes, where you put a camera and instruments in. And that allows you to do it a lot less invasively. It's a lot lower risk, a lot easier recovery. And essentially what you're doing is you're correcting the muscle imbalance that's pulling your shoulder blade, your scapula, into an abnormal position. And that muscle is the pectoralis minor, is the prime culprit. You go in with the scope and you literally release that, you cut it. It's like a tether holding the scapula. Now the scapula is able to restore its normal posture on your chest wall. There's a lot of scarring around the nerves, the brachial plexus. You release those to help with the symptoms of that numbness and radiating pain. And then you release one final muscle called the subclavius, which is just under the clavicle. And that basically allows a complete decompression and a full release from the level of your collarbone, the clavicle, all the way down into your armpit. It allows complete resolution of their symptoms, restoration of the scapula, your shoulder blade position, and they no longer have that radiating pain going from the front of the chest down the arm.
When I was told I wouldn't be getting the rib resection, I was ready for both surgeries. Either way, I had to have it, but I was definitely happy that it wasn't going to be a big surgery like getting my rib removed.
The recovery for Kalib was actually very smooth. You're basically in a sling after this surgery for a few days, and patients can come out of it as soon as they want to. There's no set period of time. There's not anything you're worried about damaging.
When he first had the surgery and he woke up, you literally could see on his face the difference in the pain.
Even under all the anesthesia, it felt kind of looser, and that nerve pain just wasn't there. All I could feel was the incision pain, so I could feel a little poking pain at each of the incisions, but it honestly felt relieving because there wasn't a tightness there. There wasn't a nerve just radiating there or anything like that.
Almost immediately, when I first saw Kalib back in the clinic, he told me that he already felt better. His scapula was sitting, his shoulder blades in a more symmetric position, his arm motion was very smooth. Still a bit sore, which is expected. But over the next couple of weeks of starting therapy, he improved dramatically. Basically all the pain was gone, and he did very, very well. I was very happy.
Baylor has been amazing from day one. The very first phone call that I made to them and getting him in, when everything had taken 4 and 5 months and they saw us within 4 days, I just knew that we were in the right place.
My experience at Baylor has been amazing. Even with just the office staff and the people we deal with, scheduling appointments, have been the kindest people. And then Dr. Ahmed has been amazing as a doctor.
The kindness he showed towards Kalib, the kindness he showed towards me, I couldn't say enough great things about him. He always has an infectious energy when he walks into the room. We always have had that kind of energy. And so to meet a doctor that has it too, it just puts you at peace and you just know you're in the right hands.